Respiratory failure is inadequate gas exchange by the respiratory system, with the result that levels of arterial oxygen, carbon dioxide or both cannot be maintained within their normal ranges. A drop in blood oxygenation is known as hypoxemia. A rise in arterial carbon dioxide levels is called hypercapnia. The normal reference values are, oxygen PaO2 more than 80 mmHg, and carbon dioxide PaCO2 lesser than 45 mmHg. Classification into type I or type II relates to the absence or presence of hypercapnia respectively. Types: Type 1 respiratory failure is defined as hypoxemia without hypercapnia, and indeed the PaCO2 may be normal or low. It is typically caused by a ventilation-perfusion mismatch. The volume of air flowing in and out of the lungs is not matched with the flow of blood to the lungs. The basic defect in type 1 respiratory failure is failure of oxygenation characterized by. This type of respiratory failure is caused by conditions that affect oxygenation such as low ambient oxygen, ventilation-perfusion mismatch, alveolar hypoventilation. This form can also cause type 2 respiratory failure if severe, diffusion problem, shunt, type 2, hypoxemia with hypercapnia. The basic defect in type 2 respiratory failure is characterized by. Type 2 respiratory failure is caused by inadequate alveolar ventilation. Both oxygen and carbon dioxide are affected. Defined as the buildup of carbon dioxide levels that has been generated by the body but cannot be eliminated. The underlying causes include increased airways resistance, reduced breathing effort, a decrease in the area of the lung available for gas exchange, neuromuscular problems, deformed, rigid, or flail chest. Treatment. Emergency treatment follows the principles of cardiopulmonary resuscitation. Treatment of the underlying cause is required. Endotracheal intubation and mechanical ventilation is required in severe respiratory failure. Respiratory stimulants such as doxycycline are rarely used, and if the respiratory failure resulted from an overdose of sedative drugs such as opioids or benzodiazepines, then the appropriate antidotes such as naloxone or flumazenil will be given. See also, ventilation-perfusion ratio, pulmonary shunt, references.